My name is Piper Smith, and I'm going to discuss tuberculosis from a public health perspective. Tuberculosis still exists today, mostly due to the increase in close proximity of humans in crowded urban spaces. Since tuberculosis is an airborne disease, it is hard to protect the spread in crowded communities. Tuberculosis dates back more than 9,000 years and has been found in the bones of human and animal remains. Tuberculosis is believed to have originated in the agricultural revolution in Africa when humans started cultivating and harvesting animals. Tuberculosis occurs on a global level due to the increase in overseas travel and the ability for the disease to spread quickly. The top 10 countries diagnosed with tuberculosis are India, China, and Indonesia. Most of the countries with higher tuberculosis rates are third world countries because of the lack of education about disease prevention or cultural differences. Tuberculosis is caused by an airborne transfer of the bacteria Mycobacterium tuberculosis. There is a high risk for people with HIV, recent exposure to other diagnosed with tuberculosis, injection drug users, and the homeless population. Unfortunately, as the human population rises, so does the risk for TB due to the increase in homelessness in high-density urban areas. Also, the decrease in availability to healthcare to provide the medication necessary to the prevention of the spread leads to an increase in tuberculosis rates. One strategy being used to help prevent the spread of TB is the Bacille-Camlet-Guerin vaccine. Although it is not widely used in the United States due to its low efficacy rates, it is used internationally, especially in places with higher TB rates. The BCG vaccine is also used in patients with latent TB to prevent the dormant virus already in the body to become symptomatic and contagious later in life. Since tuberculosis is commonly tested through the Mantoux skin test, and only recently has scientists developed the blood test, another flaw with the vaccine is that it sometimes causes a false positive result on the skin test. Another easy strategy for prevention is education. Since the BCG vaccine is not guaranteed to help every case, the CDC is working on many studies to educate the public about tuberculosis, especially with the threat of drug-resistant strains. In earlier years, more research was done for TB. The U.S. began to participate in direct observed therapy as a prevention method. DOT therapy would send nurses to TB patients to make sure they would finish their medication and not spread the disease. Clinics were also put in place to educate the public about hygiene and diet advice, but also diagnose potential patients infected with TB. In 2017, over 80% of active TB cases in California were from those born outside of the U.S., such as Asian Pacific Islanders and Blacks. To solve this issue, California is working on better education programs around the threat of tuberculosis because in certain cases, cultural or social reasons explain why one doesn't want to get a vaccine or a treatment, creating more of a threat for those around them. In the early 1800s, New England, there was a vampire panic because tuberculosis was believed to be caused by vampires who had tuberculosis, and after they passed away, they would come back to life and infect the rest of the family. With the discovery of Robert Koch in 1882 that tuberculosis was caused by an airborne bacteria, it became easier to start the search for possible vaccines, cures, or prevention methods. In conclusion, the most important aspect to be understood about tuberculosis is that education is our most powerful weapon, especially when it comes to the growing population. The CDC has placed an emphasis on social and behavioral studies, which coincides with the importance of education about tuberculosis. They have also joined the effort in TB Trials Consortium and TB Epidemiological Studies Consortium, which are both programs to help find new preventative ways for tuberculosis and potentially find a more effective vaccine in the future to eventually completely eliminate the threat of tuberculosis. In my opinion, education is the way to go for tuberculosis prevention. If communities can provide enough education to lower the risk of spreading the disease, it'll inevitably help the entire community. I also believe that the federal government should start funding more towards public health policies and increase research for tuberculosis so as a nation as a whole doesn't get affected.